Hello, Dr. Michael DiMattino, Medical Director at Dominion Fertility in Arlington, Virginia. Today I'm going to talk to you about a really important topic. It's a really hot topic too, and that is fertility preservation. Women of reproductive age who want to preserve their fertility, they're not actively wanting to get pregnant today, and they have jobs, they're in school, they have other interests right now, they haven't found Mr. Right, they're not even sure they want to have children perhaps. But they want to preserve that option and their fertility, and that's by using egg freezing. It's ubiquitous, it's done all over the world, and Dominion Fertility is an expert in this area of reproductive medicine. I will tell you that there was a great article that you might want to look up on the internet in the Wall Street Journal in the May 2013 edition, written by an attorney in Manhattan called "Why I Froze My Eggs and You Should Too." And her perspective was excellent. Now, back in those days, we weren't as good at it as we are now. And she ended up freezing something around 75, 80 eggs. Way too many. Don't need that many. She was 38 to 40 years of age, and she was, sort of very, very interested in making sure she's going to have a baby. Actually, it's a very, very simple process, egg freezing. It's safe, simple, effective, and not too terribly expensive. And it does not involve a lot of time either. So if I was a lady of reproductive age and I wasn't ready to have children, I would seriously consider it. I view it like a disability policy. Probably will never need it, but you know what? If I do, it's there. As a matter of fact, one of my patients just recently had a baby from egg cryopreservation or egg freezing. And she just delivered. She was 44 years of age. So what happened was she came to see me when she was 37. She says, "Dr. D, I need to freeze my eggs." Okay. In 2 weeks, we had finished the process and we froze something like 8 or 9 eggs on her. And I said, "Okay, you probably never need these, but if you do, come back and see me." She gets married at 43 and she says to me, "Hey, Dr. D, those eggs are stronger eggs than my eggs now at 43, right?" "Yes." She goes, "Well, I want to use those because there's less risk with those eggs that I'm going to have a baby with something like Down syndrome or a genetic problem." True. So we thawed her eggs, fertilized them, tested the eggs. Dominion Fertility is one of the leaders in the United States on pre-implantation genetic testing and embryo biopsy, where we actually safely biopsy the embryo and find out with 99% certainty that the embryo is genetically normal before we put the embryo into the uterus. We did that. We put one embryo into her and she had a baby. She was so proud of it, she came to show me. And that's just what I'm talking about. She may have gotten pregnant around, but she knew those eggs were very healthy. It's very safe, and we can keep those eggs forever. So the process starts by this. You come and see the fertility doctor, and they go over a history with you and explain how it's done. And then they do a sonogram and a blood test for the hormone, anti-Müllerian hormone, or AMH. And the sonogram and the hormone test tells us about your ovarian reserve or egg quantity. In other words, how many eggs do you have? Now, this is not fair, but I know this is a fact. Women are born with all their eggs, and then you lose eggs every month, every day, until eventually you go into menopause. And what's not fair, men, on the other hand, make new sperm every 2.5 months, all the way until the day they die. I don't make the rules, I know the rules. And so those are the rules we have to live with. So, so what we do is we test this individual, this interested person, and we find out what's her ovarian reserve or egg quantity. And she may be very strong, and we might say, "Hey, you're in good shape, don't worry for a couple of years." Or we might say, "Hey, the egg quantity is not too strong or it's low, let's get some eggs out and freeze them and store them for future consideration if you ever need them." It gives you peace of mind. I view it like checking your pulse. You check your pulse, at least I do, to make sure it's regular and strong. I need to do that. So if I was a lady of reproductive age, I would consider checking my ovaries to make sure they're strong too, if at some point in my life I may consider I want to have children. So the process starts by the consultation and the sonogram and the blood test. Done. Then I can tell the patient, your egg count is such, do you want to do this? And it's very safe. It takes about less than 2 weeks to do it. We use natural hormones to stimulate the ovaries for about 7 to 8 days, and then the eggs are safely collected in the office. with a light sedation. So there's no hospital component. The eggs are collected by placing a needle into the ovaries. It takes about 5 to 8 minutes to get the eggs out. And then they're vitrified, which means they're frozen, very safe, and they're stored forever. They can last forever. So there's absolutely no reason I can think of not to do it if you're a healthy person and you want to preserve your fertility for future considerations. A lot of people do it. I had a lady today, I'm in Arlington, Virginia, and I had a lady today I just did a phone consultation with about 30 minutes ago. She's in Salt Lake City, 35 years of age, attorney, got divorced last year, and she says, Dr. D, I want to be considered for egg freezing because someday I want to perhaps consider having children. Not today, just got divorced. And she works here in Reston, and I said, fly in. She's going to be here at the end of March. We'll go ahead and do the sonogram, the consultation, and then in April, collect her eggs, done, and she'll fly back to Salt Lake City. It's a very simple, safe, effective way to preserve your fertility. The babies that are born from egg freezing are normal. There's no increased risk for birth defects. We've been doing this for many, many years. Dominion Fertility is experienced at this. We've been in business for 32 years practicing reproductive medicine. And I said to her, why don't you just do it in Utah, where you're from? And she's from a big city in Utah. And she says, you know what? I went to the local IVF center. They do IVF. They don't freeze eggs. I told her, you need to come here. So, I would strongly consider ovarian cryopreservation or fertility preservation if you're of reproductive age. The last thing I want to say, well, when should I consider this? It's best to freeze the eggs the younger you are. But that doesn't mean you can't do it if you're an older reproductive age female. Best if you do it prior to age 40, okay? And prior to age 38, even better, because the egg quality is better. Now, having said that, I just froze 11 eggs on a woman who's 44 years of age, and we're going to try to freeze some more. And it's interesting, that particular patient went to Spain to freeze her eggs. They got 2 eggs. That's it. She wasn't very happy. She thought she was getting a good deal. The price was it was next to nothing. And she said the care was terrible. So she came back here, we did it, and we got 11 eggs, and we're hoping to freeze more. So, that's it. Dr. Michael DiMattina, Medical Director of Dominion Fertility, Arlington, Virginia.